Cape Cod Broadcasting weaves the listening environments of 99.9 WQRC, Ocean 104.7, WFCC Classical 107.5, Cape Country 104, and CapeCon.com's website experience to reflect the lifestyles of the people who live, work, and play on Cape Cod. We hope that you enjoy this podcast.
I'm Laura Reckford, and this is Sunday Journal. I'm here in the studio with Vaira Harik, who is the Senior Project Manager at Barnstable County's Department of Human Services. Vaira, welcome to the show.
Thank you. Good morning.
Good morning. We're talking about the analysis of substance abuse on Cape Cod baseline assessment, which you completed recently. And we'll start with a background of why this report was done and how it was done.
This report is the product of work that the Barnstable County Regional Substance Abuse Council has been working on for the past year. The council was pulled together by Barnstable County Department of Human Services from all the towns on the Cape and many sectors involved in the substance abuse problem to think about a regional strategy to formulate solutions and plan of action to address substance abuse on Cape Cod. If you're trying to figure out where to go, you need to know where you are, and so that is the idea behind a baseline assessment, which is basically taking stock of the scope of the problem at the local level, how many people are suffering with substance abuse problems, what are the age groups of those people, what are their predominant features. In other words, what does the problem look like? And then secondly, what and where are the costs of this problem? And so our analysis is looked at from a substance point of view. We looked at addiction to alcohol, to heroin and opioids, marijuana, and then there was an other drugs category. And we looked at the sectors in our community that are on the front line dealing with the substance abuse problem. And these are people engaged in prevention activities, harm reduction activities, law enforcement activities, which means the courts, probation, the whole gamut, as well as treatment and recovery activities. And what we found was an extraordinarily large amount of money being spent, we estimate, on dealing with the direct costs of dealing with substance abuse on the Cape. That number came in at about $110 million per year. And our baseline year was 2013, which is the year for which we had the most complete data. On the substance side, we found that we have equally large and impactful problems from both alcohol and heroin opioids. When I say heroin opioids, I mean the heroin that you hear. It's become quite lethal because it's being cut with fentanyl. And also the opioids, meaning the prescription painkillers that have flooded society for at least the last 5 years.
110 million is an extraordinary number.
Yeah,
you're adding up salaries of people and the time that they're dealing during their job with dealing with these
exactly.
issues.
That's the general approach. We're taking proportion of budgets that are attributable to dealing with the drug abuse problem. For example, the sheriff is on the record and very articulate about the problem that he has in his jail, namely that at least 85% of the people that he has incarcerated are there for a substance abuse related problem.
So you're looking at the side of the courts and the police, the obvious things we think of. Mm-hmm. And what are some of the other parts of our economy that are affected by this? Well,
clearly the treatment and recovery system, what that means is that the medical and rehab individuals and agencies on the Cape that are providing services to people who have substance abuse problems. Other sectors are, people engaged in prevention activities, which I should say is a minuscule amount of the expenditure. Less than 1% of the $110 million that we're talking about is spent on prevention, which should make everyone's hair stand on end who's listening to this, because common sense would dictate as well as the research dictates that if you really want to get a handle on a problem, you do as much preventive work as you can alongside the treatment work.
And by prevention, we're talking about perhaps the teacher in the classroom who presents materials or slideshows to their students.
Yes, well, prevention, has to, and everyone's reflex to this is, well, we have to start with the kids. They're absolutely right. There are a variety of different sources that we've cited will state that, they've let's say, how do I put this? There's a treatment individual who said that he's never treated a person with a heroin problem that hadn't already abused marijuana and alcohol. So we really have a need to really seriously address this problem at the school age level, and I'm not talking just high school, at the middle school age level. And the kids, reaching youth and kids in the schools. And it's also equally important, and the schools people and parents will tell us, it's equally important to provide education and outreach to the kids' parents, because they are modeling the behaviors in the home and in the community that the kids are replicating in their lives. And there is we have found a serious need to address parental education issues as well as prevention issues directly for the kids as well.
And how do you do prevention education to the parents? Is it a backpack flyer home? Is it advertising? Is it forums that you hope people come to?
Honestly, it's all of the above. There are what we call evidence-based ways to approach this. The programs and initiatives, community-wide initiatives, that need to take place on a sustained way over a long period of time. The one-shot, don't drink and drive when you go to the prom type of stuff, that sort of outreach, there'll be a blip in understanding and reactiveness on the part of parents and kids, but it tends to tail off unless there is a sustained effort, educational effort, that actually gets to changing the community norms around substance abuse and around sort of parents and the like. So there isn't a one. There are programs and there are approaches to doing this, which I won't bore you and your listeners with. That's a whole nother session. There are evidence-based ways to go about this that are out there. What's necessary is, and again, this is with regard to prevention, is summoning the will on a political level and on a regional level to address the problem in a concerted regional fashion.
Now, the study came out with this 110 million number. When the findings were released, what was the reaction from the community? I think the local press, did a very good job in characterizing the results and discussing them and placing them in context. They did a great job. We received, front page headlines. We received some emails, several requests to speak before other community entities. But all in all, the response from the community and the people who are working in this sector and feeling this issue was not one of terrible surprise. People recognize that this is an extraordinarily impactful problem. And the reason that it's at the forefront of people's minds is because of the heroin and opioid emergency that we have underway here on the Cape, statewide and also nationwide. The surprise, if I had to characterize any of the reaction as one of surprise, it would be in the area of our findings on alcohol abuse on the Cape. That has the number of people addicted to alcohol on the Cape. We estimated somewhere around 17,000 people. And this is not people who drink, which is a far higher number. Most of us like a nice glass of wine with dinner and so on. These are people addicted to alcohol. They far outnumber the people addicted to other substances all put together. And this is what we call in public health an endemic problem. Alcohol abuse is an ongoing, grinding,
generational problem that we will ignore at our peril. We have to deal with this problem because alcohol is a gateway drug. It's a gateway substance to the harder stuff. So the surprise is in the area for people, in the area of the scope of the alcohol addiction problem. Now, people in the treatment community, our colleagues at Gosnold will tell you that this is a problem that they've recognized for a long time, and they've been talking about for a long time. But now we have some quantitative data articulated on a regional basis that really discusses this and sets it out.
I'm Laura Reckford, and this is Sunday Journal. I'm talking with Vaira Harik, who is the Senior Project Manager with the Department of Human Services for Barnstable County. We're talking about the substance abuse baseline assessment on Cape Cod, the report that was recently completed. Now that you have the findings and you've done this baseline assessment, Vaira, what's next?
Excellent question. This is let me put it in context for us. These results, these are the numbers, these are the hardcore numbers that describe our problem from an epidemiology point of view, in other words, how widespread the problem is, and from a financial point of view, from a cost analysis point of view. But what's not here yet and what we're working on now is the qualitative side of the work. And that qualitative means sort of at the human level, what have people's experiences been with this issue, and what is the viewpoint at the local level from a variety of different groups on how to deal with the problem, what its scope is, and what to do next. And so for the qualitative work, we've undertaken a series of focus groups, which is a research tool that brings people together in a concerted fashion to discuss the problem, and the process elicits findings from these groups. And we're doing at least 15 of them Cape-wide. We started a couple of weeks ago, and we'll be doing this. Let's look at the schedule here. We'll be doing this for at least another 3 weeks. And the groups that we've been talking to are business owners and employers, family support groups, people who are in recovery, substance abusers who are in recovery, seniors, school nurses, the courts, youth themselves, pulling together a focus group for kids, the Police Chiefs Association, in other words, law enforcement, behavioral health providers. And that's important because there's always a very large mental health component to a substance abuse problem. School superintendents, emergency room staff, the faith-based community, the groups that you would normally think of to want to talk to when you're trying to pull together a solution to a problem. And I can tell you that the numbers part of this was easier for me. If any of it was easy, the numbers part of it is easier for me than being a part of these focus groups and observing and listening to what people are going through in our community. It is trying. It is emotionally trying, and it's impactful. It is impactful, and we have a moral obligation. In science, one rarely hears the term moral obligation, but I'm going out on a limb and saying it. We have, as a community, a moral obligation to deal with this problem at its roots, and we'd be remiss if we didn't do so, because it is a pervasive and impactful problem.
Now, is there a way that members of the public, and you've just read off the different groups, if someone is thinking, gee, I'd like to be a part of this, is there any way they can do that? Or do you have other suggestions, perhaps, for members of the public who have been affected by this problem to somehow participate or get you some information?
Sure. Well, for the focus group initiatives, we've selected, we've invited specific people that are known to us or to others in the community as people, to some extent, some go-to people that are going to be knowledgeable and provide us with additional richness in the areas that our work needs. So focus groups that's a long way of saying focus groups are by invitation. And there are specific methodological reasons for that. However, we are going to have more open community forums in the coming weeks. They haven't been planned yet, but when we have when we have a full-blown set of results that also mirrors the qualitative side, and when we've got a plan in place, a draft plan that's ready for consideration by the community, that's going to be the point in time for people. We'll have done the legwork on the qualitative and quantitative side to articulate the problem and set it out, so that people don't have to bother themselves with that. The community will be in a position to just respond to the facts that we set out, and they're not our facts. Facts are facts. These are findings. And so there will be some community events at which that would be the appropriate time for people to show up and voice interest, concern, and thoughts about where we go from here.
And when do you think you'll have that final report? I know you're doing the focus groups now. Are you thinking that you'll do the report right after that, or is there another step? The final report per se is really the Regional Substance Abuse Council's plan of action. And we expect to have a plan in place that reflects the findings and the best thinking about where to go as a region, some best thinking on next steps. We expect that in the early to mid-July timeframe. Oh, coming right up.
Yeah.
So not too far away.
No, not at all. I mean, what we don't want to do is drag this out. But at the same time, we want to be responsible. We want to do it as quickly as possible, but as responsibly as possible to capture the information that's necessary. People see this on a daily basis, and people are suffering from this daily, and so people want to do something. But we want to help our community do something, not in a reactive fashion, but in a planned and deliberate fashion, so that what we engage in, what we undertake in terms of interventions on a community basis, can be measurable and show results over time. There's not a quick fix for this. This is going to take a generation or two to fix, the same way it took a generation or two to really impact the use of tobacco. I mean, we had the Surgeon General's report 50 years ago, in the year I was born, in 1965. We're 2 generations later, and we've made significant gains in tobacco use. We have issues as societal issues here that, of course, here on Cape Cod and the Regional Substance Abuse Council is not going to, does not presume to think, well, we're going to be, changing society. But we want to provide the right kind of interventions and advice and support for our community going forward that is going to contribute directly to that sort of secular change.
And for people looking for just general resources about the substance abuse crisis, people to go to, numbers to call, I think that the county website has that.
We have a very comprehensive compendium of numbers and resources to call. You can access all of it, as well as the copy of the baseline report that we've been discussing on the County Department of Human Services website, which I will say slowly, it's not very complicated, bchumanservices.net.
And unfortunately, we're out of time. I've been talking to Vaira Harik from Barnstable County. She's the Senior Project Manager with the Department of Human Services. And we've been talking about the work the department is doing on analyzing the drug abuse epidemic on Cape Cod. Vaira, thank you so much for being with me here today.
It's been my pleasure. Thank you.
I'm Laura Reckford, and this is Sunday Journal.
This podcast is a presentation of Cape Cod Broadcasting, which is solely responsible for its content. Thank you for listening. For more information, please visit us at capecodbroadcasting.com.